Hello students, welcome to this tutorial of fundamentals of nursing and the nursing process. In this session, we are going to discuss the nursing process in more detailed way, with our main focus on defining nursing process, state the components of nursing process, explaining the characteristics of nursing process, and we are going to measure into looking at two major types of nursing diagnosis. So these are our learning objectives in this session. Without wasting time, let's look at what nursing process is. The nursing process involves these 5 major steps, which are abbreviated as ADPI, with A, assessment, with D, diagnosis, P, planning, I, implementation or intervention, E, evaluation. Don't forget the memory aid, ADPI. Okay, so with these 5 major components of the nursing process, we say all these are done in a systematic manner, meaning that you need to start with assessment, you go to making a nursing diagnosis, you plan, you implement, and then you evaluate. Okay, so now, since we've looked at the components, let's look at the definition. What is nursing process? Of course, there are a number of ways, a number of accepted ways you can define nursing process, but I'm going to define nursing process in this way. The nursing process is a problem-solving approach to clinical decision-making that enables nurses to provide evidence-based holistic care. Okay, so we must be able to know that the nursing process is a scientific approach. Okay, the problem solving one to the clinical decision making. Okay, whatever that decision as a nurse you are going to make, once you come in contact with the patient, whatever you observe, whatever they tell you, whatever you measure, and that enables nurses to provide evidence-based, okay, the information that is proven and verified, holistic care, looking at the patient as a whole. That is holistic care, looking at all aspects of the patient, spiritual aspects, emotional aspects, social aspects, physical aspects of the patient, considering all aspects of the patient. That's holistic care. Okay, so now with this nursing process, it has some characteristics that we should understand what the nursing process is all about. The characteristics, more like the features that define who you are. We're also looking at the features that define what nursing process is all about. The first one is that the nursing process is systematic. What does this mean? This means that the nursing process follows an organized step-by-step method. The step-by-step method is the ADPI, from assessment going to diagnosis, going to planning, implementation, and evaluation. A simple example on this one is in a situation where you can't make judgment. You can't evaluate your work minus you doing something, minus you assessing. You can't make a diagnosis minus assessment. You can't plan without the nursing diagnosis. You can't intervene minus making a goal. Okay, so this is basic at what it means by nursing process is systematic. Let's go to dynamic and cyclic. What does it say? So with dynamic, we are saying that the nursing process is an ongoing, continuous, with one step leading to the other. Each and every step in the nursing process leads to the other, logically leading to the other. So that's what we mean to say it's dynamic and cyclic, changes from time to time. However, at the same time, with one step leading to the other. When we look at the assessment, the nursing diagnosis is going to depend on what you are going to assess. If you make the wrong assessment, definitely you are going to have the wrong nursing diagnosis. Same with if you have the wrong diagnosis, you are going to plan it poorly or wrongly rather. For example, if the patient is having um, emotional disturbance and then you diagnose that they are having difficulties in breathing, whatever intervention is not going to be intended for the emotional disturbance. So in that way, you have swapped things and you are not doing things all right. So this will mean that it's dynamic and cyclic with one step leading to the other. Even when you are evaluating or you are doing all the kind of practices or activities, make sure that with one activity that you are doing is going to lead to the other. Okay. And we have patient-centered, one of also characteristics. The third characteristic, the nursing process is patient-centered. What does it mean? We mean to say that the care is individualized to meet the unique needs, preferences, and values of the patient, rather than focusing only on the disease. So it's about patient-centered. We want to meet the unique needs of the patient. Okay, so our main discussion in the nursing process is an individualized care to the patient. We are looking at the patient alone and not looking at the ward. We are not looking at how many patients we have in our ward. We are looking at Mr. Banda alone and he meet all their unique needs. If at all they are having nutritional imbalance, if at all they are having, if they are having risks for falls because they are weak, if they are having maybe risk for infection because they have a cannula, all those kind of things. We are looking at just specifically Mr. Banda and not the ward. That's patient-centered. And it is goal-oriented. Okay. So with goal-oriented, we mean that the nursing process has goal and a specific time bound in which you should actually achieve these things. So it focuses on achieving measurable, realistic, and time-bound outcomes for the patient. Okay, probably every condition that comes and you want to intervene, you actually have a time-bound and measurable extent that you are going to treat this particular patient. Okay, so for example, if you create the goal to say improve normal breathing, okay, improve normal breathing within 1 hour of hospitalization, meaning you are going to make sure that the patient restores their normal breathing within 1 hour of their hospitalization. That is time bound, realistic, it's measurable. Okay, so that's the thing we should be able to know it. Okay, we should be able to know that it's goal oriented. It's not something, it's not a strategic plan, something that is going to solve for the future or anything. It need to be time bound. Whatever intervention that we are going to do, they need to be time bound. And then the fifth one is that it is a problem solving. Okay, so it uses critical thinking to identify actual and potential health problems and to select appropriate nursing interventions. So with the problem solving, we are focusing on the problem solving, scientifically analyzing the problem that the patient is suffering from, and then us trying to develop the interventions depending on the problem that the patient is suffering. Okay. 6, our nursing process is interpersonal or collaborative. What does this mean? So when we say interpersonal collaborative, we say it requires interaction between nurse, patient, family, and other healthy care professionals to ensure holistic care. So as a nurse, you need to understand that the nursing process is interpersonal and collaborative. You are going to integrate with the patient as well as the caretakers, including other health cares. So with other healthcare, they are going to know or when to come in. For example, you are caring for a patient with just acute pain, and then in the process, because they were weak, they fell. Okay, upon falling, that problem automatically changes. It's not a problem that a doctor can handle. It's not a problem that you as a nurse can handle. It's not a problem that a radiographer can handle, but it's a physiotherapist program now. because the patient has fallen. Maybe they might be having some kind of blockage and everything. That's where physiotherapists come in. So the role of you as a nurse, you need to make sure you see who to intervene at what particular moment. So it's interpersonal and collaborative. You need to collaborate. Okay. So now, the 5 major components of the nursing process that we've discussed, we said they are abbreviated by ADPI. ADPI. With A being an assessment, with D being the nursing diagnosis, and P being the planning or goal setting, with I being implementation, with E being evaluation. So now, our focus is going to be what we are calling the nursing diagnosis. We want to discuss the nursing diagnosis in detail. Okay, out of these components, we want to discuss the nursing diagnosis. However, just to say things on other components, we have assessment. This is a time when you tend to look at the patient, you interview them, you want to find out information that can help you to make the diagnosis. And then upon making the nursing diagnosis, that's when you plan or make goals on how you are going to help the patient. Upon planning, that's when you are going to do whatever thing that you can help to intervene. That's we call implementation. And then upon implementing what you were planning, you need to evaluate. Have my plans, or what I was doing rather, have they worked? I said the patient should restore their normal breathing within 1 hour of hospitalization. I had to put them on oxygen therapy. I had to put them in a comfortable position. Specifically, you need to mention the position. So, have they worked? Okay. So now, if they have worked, you are going to say patient's normal breathing restored, evidenced by the saturation of 96%. Or patient able to initiate conversations, because most of the time the person who can initiate conversation is the one who is feeling okay, the one who is free from pain, is the one who is free from anything, the one who is not having secretions and everything. So basically that's what these are. But let's venture into the nursing diagnosis. So with the nursing diagnosis, we have 2 types of nursing diagnosis. We have a number of them. We have about 6 types of nursing diagnosis. However, we have 2 of the clinical importance, major ones, major discussed ones. Okay, so with the types of nursing diagnosis, we have what we call actual nursing diagnosis and potential nursing diagnosis. Even the words themselves, they are telling you about what kind of diagnosis are these. Okay, so at this particular time, you should be able to differentiate a problem from a nursing diagnosis. A problem, if we say someone is having acute pain, that is just a problem. However, if we add on to say acute pain related to inflammation secondary to surgical incision, we've included other information, proven information, then at that particular time it becomes a nursing diagnosis. So now, what differentiates a nursing diagnosis from the medical diagnosis? You should be able to know. The medical diagnosis, for example, like pneumonia. Pneumonia is a medical diagnosis. It's not a nursing diagnosis. A nursing diagnosis is always related to a cause. Okay, if it's actual, it's just going to relate to cause, and you are going to give evidence. Because the actual will mean the problem. You can see the problem. The problem has arisen. If it is a potential nursing diagnosis, it's something that might arise or may come. So it cannot have evidence. Just like right now, you are hoping to have, let me say, you are praying to have cars. You are praying to have everything. Okay. you have the potential to have those cars. But if we tell you today to say, show us the evidence, no, it doesn't make sense, because everything that is potential, it's something that can arise. Does that make sense? Okay, now let's pass through what each kind of nursing diagnosis mean. So now we have actual nursing diagnosis. Actual nursing diagnosis always follows this format. We have the PACE. The PACE is an abbreviation for actual nursing diagnosis format. The actual nursing diagnosis will always have a problem, will always have a etiology, meaning the cause, and then we always have signs and symptoms. Signs and symptoms are going to act as evidence. Follow me carefully. Signs and symptoms are going to act as evidence. It's something that you can see. It's something that the patient is complaining of. Okay? It's something that you can see. A sign is something that you can see, but symptom is what the patient is feeling. For example, headache is a symptom. Vomiting is a sign. So now, the actual nursing diagnosis, we said actual things. When we say actual things, we mean to say things that exist, things that as you can look at visibly. So what are these actual nursing diagnoses? We are saying that the nursing diagnosis has 3 components. Take me 3 components: problem, etiology, signs and symptoms, that is evidence. So it will always have a problem, it will always have a cause, that is etiology, and it will always have evidence. Okay? What I was saying, with an actual, we have evidence. What do you see in this side? In this side, you can see a woman holding the chest. This particular person, you can visibly tell that this particular person is having some kind of pain. You see it. So you should always know that the actual has evidence. So let me repeat the format of actual nursing diagnosis. 1, we have the problem. For example, in a situation where ineffective airway clearance, in case the patient is unable to breathe well. What is the cause of that? Excessive bronchial secretions. It might be they're having a lot of secretions that is causing ineffective, meaning they are not effectively clearing their airway. What is the evidence? Evidence, we can have productive cough, abnormal breath sounds, or rather crackles, difficulties cleaning sputum. So you've seen the format of an actual nursing diagnosis always have 3 components: problem, etiology, and evidence. Evidence because it's an actual, you can see it. Just like in the previous slide, you can look at the patient that they are not well. Okay. So these are some of the common examples of actual nursing diagnosis. We have 1, imbalanced nutrition, less than body requirements. Imbalanced nutrition, less than body requirements, related to decreased appetite, evidenced by generalized weakness. So we're saying imbalanced nutrition, less than body requirements, meaning that the nutrition status of this particular person is not intact. Okay? So this thing, you have come up with the imbalanced nutritional status because you've seen that the person is looking weak generally, very weak. Okay? So after looking at their weak, you ask them to see, are you eating? Then maybe the bedside that tells you to say, the patient is not eating. They have not eaten. They just drink water and just few kind of food. So you can now come visibly to say that you have evidence, and you have the evidence and you have heard through clinical judgment, you have seen everything, then you can come up to say imbalanced nutrition less than body requirements related to decreased appetite, evidenced by generalized weakness. These are actual you have seen. Then you go on you go on this patient number 2. They are restless. Maybe they are moving, they are doing what? They are trying to hold their chest, they are doing everything. Okay? You realize to say that they are having some secretions in the nose, the mouth. They are having some secretions. You as a nurse, you are going to make a decision to say, oh, you are going to critically think about it to say, so they are actually doing this because of these secretions are blocking the airway. So you are going to say impaired gas, specifically you're supposed to write impaired gaseous exchange related to accumulation of secretions, because when the nose and the mouth they are full of fluids, secretions, mucus, no one can breathe well, evidenced by restlessness, because they are lacking tissue perfusion. Oxygen is not reaching the areas. Okay. The third one, acute pain related to tissue inflammation. So this particular person is having some acute pain, and then you realize to say that they were just from surgery 3 days ago. They had a surgical incision. It's a cut into the oasis. The oasis, the it could be in the stomach, on the abdomen. So this is a surgical incision. And then maybe you are walking by this bed and you looked at the patient that they were giving a facial expression of pains. Okay, you asked them about the pain. They said the pain is severe, it's out of 10. Then you try to find out, you find that they are having surgical incision. Then you realize, say, oh, so this is actually they are in acute pain related to tissue inflammation secondary to surgical incision, as evidenced by verbal report of pain score 8 out of 10, or facial expressions of pain. You can easily see that someone is having some kind of pain. So now, here we have ended with the actual. We are done with the actual that we have been describing. We are looking at the actual nursing diagnosis. Now, let's look at the potential. What is with the potential? So on the potential, I've indicated to say that something that may arise when you have the cut into the skin here. It doesn't mean that the microorganism has already gone there. It's just a cut. If it can be cleaned well and bandaged, there would be no risk for infection, because you have cut into the skin and you have microorganisms all over the body surfaces, right? You have microorganisms all around here. If we get this area, we get a swab and put it on the microscope, you'll find that there are organisms, the microorganisms here. But if at all this wound is not going to be cleaned and bandaged, the microorganisms are more likely to come here. But if you have just cut yourself now, can you say that you have an infection? No. But if you take time, the infection might what? May arise. So now, looking at the fact that the infection may arise, this becomes now a potential, meaning something that is capable of becoming an infection. That's what we mean, rather. Meaning that this particular wound is capable of becoming infected. Are we moving together? I gave an example. If you have the potential to build the house or you have the potential to get rich, you can't give us evidence of your riches. Just like here, this wound has the potential to be infected. You can't give us evidence that it is infected because the person has just cut themselves now. Hope we're moving together. So now, what about potential? What is this potential? So a potential nursing diagnosis is also known as a risk nursing diagnosis. It describes a problem that has not yet occurred. It describes a problem that has not yet occurred, but the problem is vulnerable. Just like the slide that we are from looking at, the person has a cut, meaning that they are vulnerable to that particular to that particular kind of infection, to developing it due to certain risk factors. What are the risk factors of that wound? The risk factors of this thing is that microorganisms are all over the body surface. That's the risk factor. So if it stays like this, they can easily migrate and infect the wound. You get it? If you can look at this particular two, we have looked at scenario A and B. If you look at scenario A, there is no break into the skin here, meaning that the microorganism cannot find themselves in. But what happens when someone has a cannula? This cannula, once it is not cleaned, once it is not changed regularly, the person is more likely to develop infection. Okay? So we don't mean to say if you have put the cannula today, meaning that the person has been infected. No. It is still clean and the microorganisms have not come yet. But if you are not cleaning it, you are more likely to invite the microorganism. That's what we mean. Okay, so what is a potential nursing diagnosis? You should know that the potential nursing diagnosis, of course, it has the problem and etiology. It has the problem and the cause, but it doesn't have any evidence. Why? Because we just think it might come using risk factors around this patient. For example, if the patient is on a high bed and it doesn't have side rails, the side rails are the ones which keep the beds the patient not to fall. If they are not there, you can look at that risk. Say, this patient is at risk because they are looking weak, they can fall. So let's look at the potential nursing diagnosis. Risk for infection. Risk for infection related to invasive procedures. So this is just a format, but you only choose one thing. Risk for infection related to invasive procedures or surgical wounds or IV lines or decreased immunity. If the immunity has been decreased, you are at risk of getting infection because the body cannot defend itself at this particular time. That is risk for infection, like the one we saw here, there, IV line. We saw the IV line being inserted here. IV line. They are at risk for infection. Why? In case where they are not cleaning it and everything. The second one, risk for impaired skin integrity. Related to immobility, pressure over bone prominences, or poor nutrition and moisture. So they are more likely to be to have break into the skin. That's what we are taking. Risk for impaired skin integrity because of pressure sores, pressure over the prominence areas. Imagine you are just sitting in one position for 2 days. You are more likely to have problems in those particular areas. Just boarding a bus for 9 hours, you feel pressure and you need to bath warm water. Now, imagine yourself, imagine this patient cannot turn by themselves and then they are in that position for 3 days. What is it going to cause? It's going to cause wounds in those prominent bone areas. Okay, and then we have risk for falls. What can falls arise from? Related to weakness. If the patient is weak or if the patient is dizzy, okay, if the patient has taken some sedative medications that are going to slow down the central nervous system, impaired mobility. In case you have compromised mobility, let's say you are using crutches to walk, the other hand is you are having a fracture. The fracture means the leg is broken, right? So that is these are a potential nursing diagnosis. Okay, so risk for falls. This one is a potential nursing diagnosis. Okay, not like the way the patient has fallen. In this way, it becomes actual. But in case the patient is sleeping on the bed, you can look at this bed. This bed is not having its rails. These are rails. They are not raised. So the patient was probably weak and they fell. Okay, so risk for falls is a potential. Okay, it's a potential nursing diagnosis. So now, how should you write them in case they tell you that write two potential nursing diagnoses depending on the condition of the patient. You are just looking at things that can arise. So one, risk for infection related to unchanged intravenous cannula. Risk for infection related to unchanged intravenous cannula. That makes sense. Risk for impaired skin integrity related to pressure over bone prominences. You haven't seen any evidence because these things we are supposing they may arise. Risk for falls related to general weakness of the patient. You get it? So now, the one we said unchanged intravenous cannula, this is a risk for infection in case you are not changing. That's why we said risk for infection related to unchanged intravenous cannula. Of course, today you have put, but tomorrow it might be dirty and attract some microorganisms, particularly bacteria. So it can be infected. But if you change the risk, you are reducing it. But for as long as you have a cannula, you are at risk. Because that cannula can take some days without cleaning it and everything. But we don't mean to say you are infected. We can only confirm that you are infected upon testing. Okay? Upon doing sensitivity tests, we see the bacteria present. Okay? So now, this is the end of this tutorial. And if you've reached up to this far, please don't forget to subscribe. And in the next session, I'm going to record on the nursing care plan because now you have understood the nursing process and you've understood the actual as well as potential nursing diagnosis. So in the next session, we are going to know how to manage conditions. All those things that we are mentioning, how can you prevent them, how can you intervene, and how can you evaluate. All right, thank you for watching.